You know those laugh lines or those frown things around your face that some people have a tendency to get? Well, there's a way to get rid of them, and our next guest, Dr. Michael Silberberg, is here. He's a facial plastic surgeon who is on the cutting edge of what's new in cosmetic surgery, and also joining him is James McMillan. He's going to be our patient today. And we were talking earlier on the show about this new, well, actually it's not new, but it's called Botox, which is actually botulism. Explain this to me.
Well, it's actually a toxin from a bacteria. It's actually one of the most powerful neurotoxins known to mankind. But it's been used in medicine for over 20 years for other purposes.
To do what, for instance?
Well, it's been used for facial tics. People who have had, neurologists have used for people who have hemifacial spasms where the face contracts. It's been used for people who have eye tics. It's also been used for people who have problems with like spastic vocal cords, so they have a tough time making specific sounds, and it just relaxes the muscle.
Now, is this procedure relatively new, using it in cosmetic surgery?
Well, the application's relatively new. It's only been used over the past few years.
Who discovered this? Who would think of putting botulism bacteria into one's face, and why are you doing this?
Well, I'm trying to combat having the deep crevices in my face later in life. I'm starting, at this point in my life, starting to see the lines appear.
But you hardly have any lines, so this is this is a preventative thing?
But this is something we're seeing. We're seeing a lot of people in plastic surgery in general, and facial plastic surgery, is where people are coming in earlier. Before they need major or comprehensive surgeries, big facelift surgeries, or have everything done at once, they're coming in their early 20s or early 30s, having minor fix-its done, if they have specific lines they're trying to address with fat injections or Gore-Tex implantations, or the Botox to get rid of specific lines. It works really well on young women with the laugh lines around their eyes.
All right, so show us exactly what you're going to do, Doctor, to Michael.
Okay.
Explain to us what you're doing. You have the Botox
We have the
medicine.
Botox drawn up here, and what bothers James primarily are when he squints out in the sun primarily, you don't wear sunglasses, you get these deep furrows, which are caused by muscles. All right? So what we're doing is we're going to actually use Botox, which is a muscle relaxant. It actually works at the junction between the nerve and the muscle, and it prevents the muscle from making that contraction.
Okay.
If it contracts, that's what makes the line. So actually, when we get facial lines, they come from primarily from muscles that are overactive. So we're going to actually relax that muscle. So I'm going to have James actually frown for me here.
Okay. Oh, is this going to hurt?
It's going to pinch a little bit. It's a very fine needle.
Are you okay? Are you okay?
I'm fine.
It just feels a little warm as it goes in. These are two specific muscles that we're going to eradicate their activity.
Okay, now how long is this going to last for him?
It should last about 3 to 4 months initially.
Yeah.
And then subsequent injections will last longer, up to 6 months or so. And the more you use over time, the longer it'll last. And that's all we're going to do.
Okay. So are there any side effects from this?
There are no real side effects from it. Whereas other people have used collagen to fill lines, there are side effects from allergies. There's no known allergies to Botox.
Now, isn't botulism a deadly kind of bacteria? Botulism, isn't it deadly?
If it's used in big doses, we're using a very, very minuscule dose, and there are no effects other than the local effect that we're seeing.
All right, so this effect is right away. I mean, you get results right away from this procedure.
Well, actually, James is going to see a small effect initially, and then over time, he's going to have an increasing effect. It takes about 2 to 5 days for that effect to take place.
Okay, well, thank you. And if you want to speak to Dr. Silberberg, if you have any questions, you can reach him at 310-247-0029. And I guess we'll... Are you okay?
I'm fine.
Did it hurt?
No pain at all.
Preventative. Okay,
Absolutely no pain.
All right, so we're going to see the results of our final makeover from our moms, who are they're in the trailer with Christina. And when we come back, we'll see how they've done. And you did very well.
Thank you.
Except we got to get the blood off your forehead. Okay.